Welcome to State of Affairs. I'm Steve Adubato. We are coming to you from the Agnes Varis NJTV studio in Newark. It is my pleasure to welcome back once again Michael Maron, President and CEO of Holy Name Medical Center. Good to see you, Mike.
Good to see you, Steve. Thanks for having me.
So much going on. Real quick, I know that CMS is a federal, is it an agency?
Yeah, Medicare and Medicaid. Right, so CMS is the division that oversees Medicare and Medicaid programs.
Right. The reason I mention it is because they bestow, they award from, I guess it's 1 to 5 stars, based on a whole range of variables. And you guys received, your organization received a 5-star rating from the Center of Medicare and Medicaid, CMS, the federal government, because?
Because of quality performance. It's basic objective metrics that CMS draws from every hospital across the country that participates in Medicare, which is all of us. And they use the same objective criteria to compare all the hospitals across the board. 5 stars are rare. It's their highest rating.
How many in the region?
Only 5 in the whole New York metropolitan region, only 3 in New Jersey. So it's Holy Name, Morristown, and St. Luke's in Warren. Those are the only 3.
So listen, by the way, let me disclose that for many, many years, Holy Name has been a supporter of our programming, and I've hosted the annual gala that in New York, by the way, that Holy Name holds. Question on the national landscape. Well, relatively new president, really, 2nd year now.
Yeah.
New governor in New Jersey, several months in.
Right.
Biggest challenges you and your colleagues in the healthcare/hospital world face on the national and state level are?
Well, I think a lot of it has to do with the crushing cost that has not depleted at all. I'm concerned about it because there are a lot of fighting constituencies who want to see, the system sort of stay the way it is. They profit under it.
But what does that have to do with the challenges?
Well, because the challenges are you don't want to deliver high-end quality at any price. And you got to get the cost under control. And at the same time, you don't want quality to suffer and be sacrificed in the interests of lowering costs.
What I'm curious about is this. To what degree, Mike, do you believe that those in public life, in Congress and the state legislature, governors, presidents, et cetera, either have an understanding of the impact of policy decisions, and B, even want to have that understanding? Loaded question, I know. A
loaded question. Well, it is very complex. So I think very few people have a comprehensive understanding of the entirety of the system. Because when people say healthcare reform, that embodies a whole lot of different industries. It's not just hospitals and doctors. It's insurance companies. It's pharma. It's suppliers. It's never ending. It is a big, big entity. With many, many sub-entities that are very large in the economic sector.
So when you see it, dare I say, politicized by some saying, let's do away with Obamacare, it's destroyed people's lives, and others have said Obamacare was the answer to all of our problems, you sit there and go,
no. I said, like anything else, there are benefits to it and there are detriments to it because no one has thought it out fully and comprehensively. So there was value. There were some good components to the Affordable Care Act and individual mandates, access, ensuring people who didn't otherwise have access to it. And there were other mandates that weren't so good. Just throwing one out without the other isn't the way to sort of fix this.
Mike, we've talked about diversity before. And what I'm struck by is the population you serve is very diverse, but there's also a large Korean population. We've talked about this before.
That's right.
How are you serving that community in terms of healthcare? And is it any different than you would serve how would you serve anyone else? What
we've learned through this is that when you really adopt, not for a public relations perspective, but for a true delivery of care, a culturally sensitive approach. So I get to know you. It's one of the detriments of the current system. The economics do not pay me as a physician or a provider to invest time to really get to know you.
Why does that, hold on, respectfully, devil's advocate, why do you need to why does a physician, a nurse, doctor, why do they need to get to know who I am, where I'm from, my culture, in terms of treating me?
Because you are unique. There is only one Steve Adubato in this world with your DNA, your genetic makeup, and your disposition as to how things are going to work. And as much as we try to get cookbook medicine and we try to standardize things, there is value to that, but to a point. At the end of the day, you are still a unique individual. And if I'm going to deliver the most effective care to you, I got to understand those nuances, right?
And so you're saying, is it different the way you would treat someone who happens to be Korean, who has a different diet and history?
So what you do is you bring in the understanding to the Korean culture, and the Korean dynamic is to Am I going to be compliant with my meds? What's my understanding as to who pays for this? What's my understanding as to should I be responsive to the doctor, or should I go for some other homeopathic therapy and avoid the prescriptions that you gave me? What are my superstitions that impact me from following up or providing care, or intimidate me from providing care?
Cultural awareness.
Sure. It's very important. It's critical. And what you find is you can communicate and you can execute much more efficiently when you have that sensitivity.
You know, it's interesting. Cultural awareness is also relevant when it comes to end-of-life issues. We've done a lot of programming on end-of-life issues. A priority for you and your colleagues. How so?
Well, when you look at the cost of healthcare, and you look at New Jersey particularly, we rank dead last according to the Dartmouth Atlas when it comes to end-of-life care in this country, right? So the chances of you being in an ICU, racking up ridiculous amounts of bills, futile bills, in the last 6 months of life are greater in New Jersey than any other state in the nation. That's a tragedy. Right? And it's a multifaceted tragedy. It's not just a function of the healthcare system. It's a function of the culture of society as a whole. But it's a function of the medical community and what we do and the economics. So we opened an experiment up in Saddle River. It's a 20-bed inpatient hospice dedicated only to adding quality of life to the last days of life. And clinically, it is by far the most successful program I've ever launched. Financially, it's a challenge because the system doesn't recognize it. I use this all the time up there from a cultural sensitivity, and we've seen this all the time. I get a 95-year-old priest who has no siblings, no family. He's all alone. He comes to the villa in his last days, Villa Marie Claire, right. Which is our inpatient hospice, right. To spend out his last days of life with us. We care for him. We comfort him. We make sure his transition is as peaceful as it possibly can be. Contrast that to the 38-year-old mother of 4 who has a husband, 5 brothers and sisters, parents are still alive, active in her community. She comes into the villa, you know, for her last days of life. What do? You got to support that entire community that's around that individual, right? We get paid the same.
Mike Maron, one of the many CEOs in this state and region, hospital CEOs that are dealing with a whole range of challenges. Mike did not talk about this. We didn't have time, but next time he'll come back and talk about the work that his organization is doing with others in Haiti, which has been going on for how many years?
Haiti, Holy Name's involvement has been 8 years. I'm actually flying there tomorrow if I can get out.
I feel like every day, yeah, well, we're right before a storm. By the way, every time I talk to Mike, he's either going or coming back from Haiti, and we'll talk about that next time. Thank you, Mike.
Thank you, Steve. Appreciate it. Okay.
State of Affairs will be right back right after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by International Union of Operating Engineers, Local 825, Guarini Institute, NJM Insurance Group, Fedway Associates, New Jersey Sharing Network, Wells Fargo, NJ Best, and by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State, and by Employers Association of New Jersey.